Testing. Hi, everyone. We're just setting up for today's session. Just take a minute. So let me just pull up the slides for today's webinar. There they are. Okay, and I'm just going to adjust these for us today. And then we'll be able to launch this session. All right, so welcome everyone to today's brand new webinar. I'm really excited about this. We got two new things here. Both the webinar itself is new, this focus on wellness models for substance use prevention. And we're also testing out the system of having this webinar be available to you on demand rather than live or just live. It's on demand. So whenever you register, you'll be able to get a link. You'll be sent a link immediately, as far as I understand it, and you'll be able to watch this recorded session. So thank you so much for joining us. My name is Dr. Chudley Wirch, and I'm CEO and founder at Prevention Plus Wellness, located here in beautiful St. Augustine, Florida. So we've got a 1-hour session. And approximately, I think we actually have a lot of slides, so I'm going to move along pretty quickly for you. For those of you that do register, by the end of the week, I will be sending everyone who has registered a certificate for 1 hour CEU for viewing this session, and also a PDF of the slides. So no worries, you'll see a lot of good content in this webinar. And in this content, there'll be a lot of links for you to go explore more information, more resources for you as prevention and health specialists. And all of that will be sent to you with the PDF. So no worries, by the end of the week, which is by the 22nd of October, if you've registered by then you'll receive the PDF, you'll receive the certificate. Okay? If you have any questions, if you need anything from me, you could always reach me at preventionpluswellness.com. That's our website. Or you could email me directly at info@preventionpluswellness.com. Or you can call us here in St. Augustine, Florida, 904-472-5022. All right, so let's launch in because we have a lot to cover. And again, really excited about this. I think this is really, really important for those of you that are prevention and health specialists. By the way, as always, thank you for all you do for families, for children in your regions, in your areas, in your nations. God bless you guys for doing the really hard and important work throughout the country and throughout the world. So we got 3 objectives for today's session. You can see them here today. Number 1, determine the connection between wellness and substance use prevention. So I think this is very important, and I'll be covering that first. Secondly, explore key wellness definitions and models. We've got a whole bunch of them I'll go through. There are many, many, many more, but I'll talk about the key models, the ones that appear to be most familiar, most often cited, and most relevant to what you're doing as prevention and health specialists. And thirdly, examine evidence-informed wellness guidelines for youth, or behavioral guidelines for you. So a little loose, but still connected content all the way through. I think prevention and wellness is the focus today. Let's start out with the question, why wellness and substance use? So I think this is an important and sort of a basic understanding. Healthy behaviors and wellness are essential. They're essential to successful and also to sustained substance use treatment, recovery, and prevention. That's something to keep in mind, and I'll even review it or restate it at the end of today's session. People with serious mental health or substance use problems are, according to Samsa, the Substance Abuse Mental Health Services Administration, dying earlier, mostly from preventable and chronic mental conditions. So that's a really important thing to remember. So you've got people that are struggling with, wrestling with addictions and mental health problems, they're dying earlier because of chronic mental diseases, suggesting a broader wellness approach to promoting and protecting health. Number three, one of our taglines has been from the very beginning here at Prevention Plus Wellness, quote, the opposite of substance use isn't just non-use, it's wellness. So the focus for us has always been on not just preventing substance use and substance use related problems and harm, but also having something greater to achieve, and that is wellness. If you try to get a picture in your mind of a young person, an adolescent, a child, a young adult who isn't using substance use, it's hard to picture them. But if you want to picture them, the way to do it is to focus on wellness. What is a very healthy person, a young person that is experiencing full well-being? You can get an image of them, you can get a picture of them, and so can youth. And of course, we want these pictures to be in the minds of youth. We want to stimulate and to cue or trigger, if you will, future images of themselves, not just not using, but again, full wellness. Number four, youth and young adults are exposed to multiple and concurrent health risks. These are both chronic disease risk and substance use risk. And there's a link there for you to learn more from that particular study. And lastly, these risks interact with each other. This is very important. And so health risks can either exacerbate and make health worse and injury more likely and illness more likely and premature death more likely, or they can protect and improve health. Just roughly speaking, wellness behaviors, health, obviously promote health and well-being, but they also help protect against substance use. And substance use makes it more difficult to engage in wellness behaviors. That's just a sort of a crude overview or model. Now, let's take a look at, speaking of models, wellness definitions and models. We're going to start out with health as wellness. Since 1948, the World Health Organization has said, and this has been mentioned probably thousands of times since then. We're talking about 70 years ago. Over 70 years ago, we've got the World Health Organization stating that health is really wellness by identifying health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So notice way back in 1948, the World Health Organization realized that health is really something broader than just avoiding risk, avoiding substance use, avoiding harm, but it's a multidimensional component: physical, mental, social, and the focus is on well-being, it's on wellness. So wellness back in 48 was viewed as multidimensional construct, and I think you'll see this throughout all the models I share with you today. And at this point, at least, there is no consensus on the definition or the dimensions of wellness. In fact, there are just dozens and dozens of wellness models and definitions. I think there's more consensus on a definition than there is on the dimensions. Back in 1959, there was a paper that was published, High Level Wellness for Man and Society, by Halbert L. Dunn, and Dunn is considered the father, if you will, of the wellness movement, and he developed a health grid. So he talked about high-level wellness. There's the link to that particular article. You're welcome to explore it once I send this out, these PDF slides out to you. Here's one version of the grid, or one iteration of the grid. Notice there's two axes. There's the horizontal axis, that's health. The left-hand side of the axis is what's the worst level of health? It's death. And then to the far right of the axis, it increases in health, and to the far end where the arrow is pointing to the right, that would be high-level wellness. So death on one hand, high-level wellness on the other. And then the vertical axis is environment, with the bottom or the southern tip being a poor environment, poor quality air and water and housing, et cetera. And then the upper end of that axis, the top end, would be a very healthy environment, physical, social environment. And so you've got these two axes, health and environment, and then you've got 4 quadrants. So in the upper right-hand quadrant, you have high-level wellness. That's because you've got high level of health and a very healthy environment. Directly below that is emerging high-level wellness. So this is where you've got, again, a high level of health for whatever reason. It could be behaviors, genetics, et cetera, but you're not in a very healthy environment. To the left lower end corner, the poor health, that's the red quadrant. That's where you have unhealthy environment and you have unhealthy health practices, et cetera. And then in the upper left-hand corner of the yellow, it says protected poor health, where you have, again, not very good health practices, perhaps, or not very good health status, but you have a healthy environment you're existing in. So this was, again, Halbert Dunn's contribution to health back in 1959, the notion of a grid and high-level wellness. The National Wellness Institute, back in the, I think, early to mid 70s, came up with this definition of wellness. It's an active process through which people become aware of and then make choices toward a more successful existence. So there's 3 components to that definition. Number 1, wellness is conscious. So there has to be a certain amount of becoming aware of you and your internal self and external self. It's self-directed. In other words, the individual has some role to play. And it's an evolving process throughout one's life, from early on through death. Number 2, wellness is multidimensional. You'll see this notion throughout all of the wellness models that we look at. It's holistic. In other words, it's complete, it includes all the dimensions. It encompasses lifestyle, as well as mental and spiritual well-being, and the environment. So you can get a sense of how holistic we're talking about. We're not just limiting to opioid use or physical inactivity, et cetera. Much more holistic than that. Number 3, wellness is positive. And it's affirming, which is a very refreshing thing after talking so much and emphasizing so much, oftentimes on risk and on substance use and on illness and injury and so on. There's 6 components to the National Wellness Institute model of wellness. You can see them here: emotional, physical, occupational, spiritual, intellectual, and social. So you can see it's very broad. There's a link there. You could learn more from the National Wellness Institute's definition of wellness. Here's another model, moving on to something called the Indivisible Self. This is unique. I wanted to show this to you because this is actually a model that's undergone an analysis, a statistical analysis. There's actually a scientific research component to this, testing the model. These other models have been largely theoretical in nature. This came from this Indivisible Self, came from a conceptual or theoretical model, and then it was tested and was revised. So this is an evidence-based model for wellness by Myers and Sweeney, 2004. The indivisible. In other words, it's all together. You can't separate it out. Self model provides a foundation for evidence-based practices for mental health and counseling. So this is a little bit interesting too. I wanted to show you this because this is a unique model, because it's a little bit more emphasis on the mental, spiritual components, because it's a counseling model versus the other models, which have been heavily emphasizing a physical self, because they're coming from, medicine and health promotion, etc. The indivisible self is based on characteristics of healthy people, and so it can be considered strength-based. Actually, I think all of these models, wellness models, can be considered strength-based. Choice-oriented on wellness behaviors reflect the intentionality of lifestyle decisions. And like all the other models, these are all theories, they're theoretically grounded. So let's take a look at the indivisible self wellness components. There's 5 of them, and you can see them here. The number 1 component is called the essential self. So this is where spirituality, notice the role spirituality has in this counseling psychological model. Spirituality is right up there, number 1, with the essential self, not religious or religiosity, but spirituality. It's a little bit different thing. Focus on, you have purpose, you view something greater than yourself, etc., rather than religious practices and beliefs. So spirituality, self-care, and gender identity and culture identity. So a lot of focus on, internal, who am I in relation to something outside of myself. Essential self, the creative self, you can see that, thinking, emotions, control, positive humor, and work, all very important. A third component of the indivisible self is the coping self, realistic beliefs, accurate beliefs. Nowadays, we have a lot of, perhaps illogical beliefs, flat earthers, etc. Stress management is important to coping self, self-worth, a certain level of perceived self-worth, and leisure is important in coping self. 4, social self, friendships and love. And 5, the physical self, exercise and nutrition. So you've got these 5 indivisible components, starting with essential self all the way through physical self. And then there's these contextual components or factors: local, context, institutional, global, and chronometrical, which really refers to, what happens to you throughout your life. So there's a link there to learn more about the indivisible self. But here's an image of it. Here's an actual picture of the model, if you will, the indivisible self, evidence-based, a model of wellness. And so you could see the indivisible self shown as a circle with those 5 main components: creative self, coping self, social, essential, and physical self, and the components around those blue circles. And then to the left are those contextual things that we talked about. So that's an image portrayal of the indivisible self wellness model. Now let's take a look at the Samsa wellness model and initiative. Samsa, the Substance Abuse Mental Health Services Administration. I think this is relevant, obviously, to all of us who are in the mental health and substance use fields. That Samsa's definition of wellness is not the absence of disease. Sounds familiar, doesn't it? Going back to World Health Organization definition, 1948. Not the absence of disease, illness, and stress, but the presence of a positive purpose in life. There's that spiritual component, satisfying work and play, joyful relationships, a healthy body, and a living environment, and even happiness. So this is a very aspirational definition of wellness. 3 components or 3 elements to Samsa's wellness initiative. Now remember, Samsa is looking at this from the perspective of wellness for those suffering from mental health issues and problems and substance use and misuse. Number 1, wellness integrates behavioral and physical health. Very important. So the wellness approach recognizes mind-body interconnect, and behavioral health is inseparable from physical health. So again, a broader perspective, an integrated perspective. That's what we do actually at Prevention Plus Wellness. We're trying to integrate substance use prevention with chronic disease prevention, or another way to look at it, substance use prevention with wellness behavior promotion. Number 2, this is the Samsa wellness model. Number 2, wellness is empowering and prevention-oriented, unlike the disease treatment model. So this approach emphasizes having positive goals, which all of our prevention plus wellness programs have. You have goal setting, positive goals to improve wellness, learning self-management skills or self-control, very important to PPW as well, and developing healthy habits. So this is again, it's a prevention model, not a treatment model. Thirdly, wellness is a journey, not a destination. In other words, it's a lifelong process. It's a process that, even if you got a wellness related program or prevention program, that's one point in your life. This is something you continue to work on throughout your life. So striving for good mental and physical health and quality of life, and so that you can be the best you can be in terms of your ability, given your unique circumstances. Of course, we're not all on the same playing field, that's for sure. So keep that in mind. So wherever you're at, whatever your circumstances, this particular Samsa wellness model says that it's all about a journey and improving yourself and achieving greater success. There's 8 components to the wellness interactive Samsa model. You can see them here: emotional, environmental, financial, intellectual, occupational, physical, social, and spiritual. And you can read these components. For example, emotional, coping effectively with life, creating satisfying relationships. Environmental, enjoying good health by occupying pleasant, stimulating environments that support well-being. Those could be outdoor environments, indoor environments, all of those things. Financial, really important to have some level of financial control in your life. Intellectual, that deals with creative abilities, finding ways to continue to expand your knowledge and skills again throughout your life. It doesn't have to be formal. Nowadays, it's even easier with internet and so forth. So continuing to learn and to explore new ideas. Occupational, you want to have satisfaction and enrichment from your work. Physical, of course, you have needs in terms of physical activity, healthy foods. And here we've got sleep mentioned, which is very, very important to the physical wellness component. Number 7, social, sense of connection and belonging and having good support system and friends. And lastly, still not necessarily last, but important, equally among all of these things, spiritual component, expanding your sense of purpose and meaning in your life throughout your life stages. Okay, that's the wellness multifaceted. And they talk about interactive dimensions. They don't really, most of these models don't really talk about how they interact, but they do say they do interact, and that's really an important component. I can talk a little bit more about that in a little bit. So just taking one of these dimensions, let's just take number 6, it is the physical. This is, again, still the Samsa's model. Samsa has a workbook, a guidebook called Creating a Healthier Life, Step-by-Step Guide to Wellness. And just taking one component, physical wellness, this is improving physical wellness. This is right out of their guidebook. You can see there's 6 components to physical wellness: nutrition, physical activity, sleep, alcohol, tobacco, and other drugs, medication, safety, prevention, medicine. And so this guidebook, I think it's a great guidebook that you could use it. You could use it with your youth, your young adults you work with, but you can use it as a way to promote well-being. So under the heading of improving our physical wellness, nutrition, for example, do you have access to fresh, healthy foods? If not, how can you increase that? Number 2, physical activity. Are you getting regular physical activity wherever you can? Are you making it fun so that you'll continue it? Number 3, are you getting 7-8 hours of sleep most nights? Now, for youth, and this sort of highlights that most of these models we've looked at, these models thus far are really focused on adults more so than youth, because youth should be getting 8 to 10 hours of sleep. So there's a little difference there. But you can adapt these for youth use. Alcohol, tobacco, other drugs. Have you tried tools that will help you cut down or quit using these substances? Well, of course, for youth, we want to avoid using altogether until they reach full brain development, 25 years of age, and they could decide for themselves at this point. Medication safety. Are you storing medications properly? And number 6, preventive medicine. Are you visiting your doctor, your dentist, etc.? So those are the components on the for improving our physical well-being, found in the Samsas, Creating a Healthier Life and Step-by-Step Guide to Wellness. And there's a link at the bottom of this page, and you can go to that guide. Now, every 10 years, there's a government document called Healthy People. The last one was just a year ago, Healthy People 2020. And for the first time, there's a goal in the Healthy People document for improving health-related quality of life. So that's HRQOL, health-related quality of life. And the goal is improve health-related quality of life for all individuals. That's the goal for the nation. Health-related quality of life, multidimensional, just like the concept of wellness or well-being. And domains include physical and mental, emotional, and social. So you can see these multiple domains. So really, Healthy People 22 is really using this wellness model. Number 4, well-being, which is wellness, is defined here: a relative state where one maximizes his or her physical, mental, social functioning in the context of supportive environment to live a full and satisfying and productive life. So there's another definition of wellness or well-being. Now, what I like about this new emphasis, this additional emphasis in Healthy People 2020 to improve health-related quality of life, I like this number 5. And we've mentioned this already, but just to highlight it one more time, instead of a traditional view of treatment or even prevention as just avoiding or minimizing substance use or illness or risk factors, well-being also focuses. So it's in addition to, it's and prevention plus wellness. Well-being also focuses on disease resistance, resilience, and self-management, self-control, all those things. And that's certainly, I think, important in the prevention plus wellness model, which we're going to take a look at shortly. Now, to date, to this point at least, I should say, we've been looking at models that are largely, I think, focused on adults. So we needed to have something to look at for youth. And so this is what I found, which I think is very good. Interesting perspective. It was designed for youth, foster youth, homeless youth, so really high-risk youth. But it's at least for youth. It's called the Well-Being Indicator Tool for Youth, or WIT-Y. And these are the health domains. So it's a wellness model, but it's also a tool for assessing. So oftentimes what you'll see is you'll have these models, these theoretical models, and then separately, you'll have some kind of an assessment or measure of them. And we're not going to go, much further than that into the assessment. But let's take a look at this a well-being indicator tool for youth. So there's 5 wellness components. You can see them here: safety and security, physical health, relationships, community, and mental health. So safety and security. What that means in this particular model is safety and security, to have stability in one's life, stability and access to the necessities, housing, food, water, education. So that's what we're sort of a Maslow's, lower level basic. We all need to feel secure and be fed, et cetera, before we work toward higher wellness. Number 2, physical health, ability to care for their bodies through prevention and self-management. Relationships, being able to have relationships that you're able to form and sustain over time, that are supportive for you. And I would say healthy relationships and healthy behaviors that support your healthy behaviors. Community of youth, a sense of belonging and connection, whether that be to school or to other youth or your culture, your community. And mental health refers to self-esteem, their ability to cope during adversity and to manage their emotions. So really good and interesting model of well-being for youth, this well-being indicator tool for youth. Three more components to this. There's three more components. Purpose, this is this spiritual piece to it. Ability to recognize their place in the world and that they're connected to something larger beyond themselves. Cognitive health, intellectual potential, and things that will stimulate them intellectually and help them grow. Curiosity, identity development, all of that is part of cognitive health in this model. And an environment, use relationships in connection with nature. So oftentimes that's missing. That could be an environmental piece. It could be considered a spiritual piece, but nature, very, very important. So these are the 8 components of this WITY model. Each of these 8 domains, youth can rate themselves on a 5-point scale from in crisis to doing great. And then if they're not doing so well, if they're toward the in crisis mode, there's also a blueprint that comes at the end of this model or this assessment tool, where youth can plan to improve one or more of their wellness dimensions. And this is certainly similar to what we do in Prevention Plus Wellness. We have youth assess their health habits, and then to the extent that they're a value for them, to then set goals and write a contract to improve their well-being. So this is a similar kind of a model, and there's the link if you want to go and explore this model. So that takes us really to the behavior image model as a wellness model. So let's take a look at it. For those of you who've been in some of our other webinars or trainings, you may be exposed to this, but the behavior image model, I oftentimes say the behavior image model is a marketing model. It is, but it's also a wellness-based theoretical roadmap for creating usually brief, but not necessarily brief, programs or interventions that use positive images to connect substance use, prevention and avoidance, and reduction to the promotion of healthy behavior. So for example, preventing alcohol, linking that with promoting physical activity. B, preventing vaping e-cigarettes with promoting healthy eating. So that's the model, it's linking. And so for that reason, it is a wellness model. It's a broader model. It's a more holistic model than just focusing on avoiding risks. Now, the behavior image model has 2 main components. The first is is designed here is you communicate positive, aspirational, largely future images to young people, whether they be children or young adolescents, older adolescents, young adults. We have programs for all these age ranges. And this is designed to increase motivation for change across diverse health behaviors. So substance use avoidance and healthy behavior promotion. Secondly, multiple behavior goal setting is used to initiate and then to increase that self-regulation, self-management, self-control over time. So you can see the components that are built in the behavior image model or that are reflected in some of the other wellness models. A simplified behavior image model logic model is this one. You start in the top and then you go down. You communicate as a teacher, as a parent, as whatever the case may be. When you communicate with young people, you communicate behavior image messages that integrate wellness promotion with substance use avoidance. This is designed to cue unconscious positive future images of themselves being fit and active and healthy and successful. This increases awareness of wellness images as values and substance use as being undesirable or harmful. This enhances motivation to set multiple behavior goals, and then you walk you through setting goals and then helping them to monitor those goals over time, thereby initiating behavior change to avoid substance use, to increase protective behaviors, both and, or plus, whatever you want to say, one and the other, avoid risk behaviors and engage in the wellness behaviors, more holistic, more wellness focused, and over time that develops self-regulation skills for you. Taking this another step, taking this just one more step further, here is speaking of steps, a 3-step prevention plus wellness model. So the 3-step prevention plus wellness model is based on the behavior image theoretical or conceptual model. So let's look at the 3-step model. Some of you may be aware of this already. The 3-step evidence-based model, and this is a screening and brief intervention, which is an evidence-based practice model, is number 1. You assess youth for their current health habits to increase awareness of their substance use and their wellness behavior. Step number 2, you provide positive image communications and feedback about each of those behaviors in that screening survey. And this is designed to cue or trigger unconscious images of themselves in the future. And then you link how substance use is harmful or interferes with that. And this feedback is designed to increase awareness and motivation for changing substance use risk behaviors as well as healthy behaviors. And thirdly, you ask youth and help them set goals to avoid substance use and increase protective wellness behaviors, thereby initiating behavior change. And to the extent that you can reinforce that and remind youth to continue that process of setting goals and monitoring goals and achieving goals, they'll develop self-regulation skills to shape their own behaviors over time. So let's look at the 3-step process a little bit more. This is this 3-step prevention plus wellness model process, screening youth for the current health behaviors. So just to give you an example of some of the screening survey questions, here they are. This is actually from our evidence-based sport, which is our alcohol and drug prevention plus wellness program. I was trying to determine what time we have left, and I actually didn't pay attention when we launched this, so I don't know where we're at. Anyway, so here are the screening survey questions. These are just some examples of some that we have in some of our programs. What sports physical activities you played last year? And these are actually from the perspective of a parent. So rather than youth themselves, does the youth get regular physical activity at least 30 minutes 4 or 5 times a week, such as riding, bike riding, walking, swimming? Do you usually eat a healthy breakfast every morning? Here's some examples: oatmeal, eggs, yogurt, fruit. Number 4, do you usually get 8 or more hours of sleep each night? Number 5, do you practice stress control most days a week? For example, deep breathing, yoga, meditation, prayer, etc. Number 6, have you ever had any alcohol? So those are some sample screening survey questions. And of course, it depends on which program that we offer as to which questions will be in there. Oftentimes, the wellness behaviors are quite similar. All prevention plus wellness programs, or most of them, focus on promoting different types of physical activity in sports, healthy breakfast and nutrition, sleep and stress control. So you can see the physical, mental component to it. Our In God's Image program actually does focus on spirituality a little bit more, quite a bit more. A racial justice program obviously focuses on something else, racial injustice, which is a risk factor for substance use. But then, depending on which program you're using, a sport will address alcohol. Our marijuana PPW program will have a screening survey question about cannabis. A vaping PPW program will have a question about e-cigarettes. Opioid PPW will have a question about non-medical opioid use. So these are some sample questions. So that's step 1. You assess them. So this is an assessment. It's wellness to a certain extent, mostly physical, a little bit mental. Wellness assessment in this question. This increases awareness of the use healthy habits. Secondly, provide positive messages, integrating wellness with avoiding substance use. This is a 2-step messaging process. The goal here is to get youth, is to trigger in the youth's mind unconsciously a picture of themselves engaged in these healthy behaviors and substance use as being counterproductive or harming. And so it's a two-step process. The first step is you highlight the positive images and other benefits of a wellness behavior, like here, quote, young people who engage in regular physical activity tend to feel energetic, sleep better, and look more fit, active, and confident. So what you've got here is you've got your target group, young people. You've got the target wellness behavior, regular physical activity. You've got your images that are so very powerful, and they elicit, again, unconscious images of the youth themselves, seeing themselves in the future being more energetic, active, fit, confident, very, very motivational, and even other benefits like sleeping better. And then on the right, you've got an actual illustration of a young person exercising. So you want to show images that they can relate to. So this is the messaging. Step one of this two-step messaging, you highlight the images and benefits of the wellness behavior. And again, these wellness behaviors could be physical, they could be mental, they could be spiritual. And of course, remember, they're all integrated. So they, even if they are physical, they still could have an impact on mental, and certainly will have that potential. And then secondly, the second part of that messaging is you link how substance use or other risk behaviors are barriers or harm this wellness behavior and benefits and outcomes. So marijuana use can reduce your energy level to participate in regular physical activity and achieve your fitness goals of being in shape, looking good, and feeling fit and active. So it's as simple as that. You're just showing how specifically in this case, marijuana can really interfere with you being physically active and engaged in regular physical activity and being more energetic, active, fit, and confident. Give you one more example of this connection of wellness behaviors with substance use avoidance. Here's breakfast and nutrition. Here's mentioning of the benefits and the images, healthy eating, breakfast, healthy foods. There's some content there, different types of foods, veggie breakfast, and really a very positive effect on how you feel and more energy for school and sports. There's some benefits. And now here's how alcohol and marijuana harms that. It can lead to weight gain. It could sap your energy needed. And so it interferes with the uptake of vitamins and minerals and nutritional benefits that you're trying to achieve with healthy breakfast and healthy foods. So avoiding alcohol, marijuana, very important because they rob your body of vitamins and minerals. So that's the feedback. And then lastly, third is having youth or set goals. Typically our goals that we offer in Prevention Plus Wellness programs are pledging or having youth either pledge or select specific substance they want to avoid, selecting a wellness area to increase and set a measurable goal. The wellness area could be, again, it could be anything related to physical activity and sports, anything related to breakfast and nutrition, anything related to sleep, anything related to stress control. And depending on whatever program you have of ours, it could be other things. Obtaining a co-signature is important. So that's why these are not just goal setting, but also contracts, identifying a place to post the goals over the next 7 days is a short-term goal setting, and then completing the 7-day behavioral calendar log. So they're off and running with initiating behavior through the goal setting. And that's the model. That's the 3-step model, the PPW model, the Prevention Plus Wellness model. It's this 3-step model right here: screening, feedback, and a goal setting. All right, the last part of today's webinar is now looking at evidence-informed wellness guidelines and recommendations. So this is all from our website. There's a link in the bottom of this page. We just updated these a little bit a couple days ago. I want to focus on these 6 areas: physical activity, healthy nutrition, getting adequate sleep, controlling stress, setting goals, and alcohol and drug use. So these are important because they are evidence informed sources, for example, like Centers for Disease Control and Prevention, which set guidelines for youth, which are important for youth and for youth services providers when it comes to helping youth set goals for themselves. What should their goal be? What should they be engaged in with regard to physical activity? How about healthy nutrition? How about getting sleep? All of these things. And some of these sources will identify specific goals. Others are more generalized recommendations and tips. So let's take a look at them. There's a lot of content here. So under the heading of physical activity, those youth ages 6 to 17 should be getting 1 hour or more, 1 hour is a minimum, every day of the week. And it should be a combination of aerobic, muscle strengthening, and bone strengthening. So the 60 minutes should be this combined different types of activities, and it even more specific. So for example, for muscle strengthening, it's a daily 60 minutes, but you should be doing at least 3 times, 3 days of the week, you should be doing things, strengthening things like climbing and push-ups and that kind of thing. It's important to encourage young people to participate in physical activities that are appropriate for their age. You don't want children to be lifting weights, for example. Something that's enjoyable and offer variety. I think these are really important tips. In addition to the goal, which is 1 hour every day, fun things and things where they may not even think they're getting physical activity, games, etc. And there's 2 sources for this. They're both Centers for Disease Control and Prevention, and there's the links if you want to learn more. So that's the guidelines. And these guidelines are very similar, not just from CDC, but from other health and fitness organizations throughout the world have similar guidelines for youth and the amount of activity they should be getting, physical activity every day. Now let's take a look at nutrition. These are some general guidelines or general tips in this case, whereas the physical activity pretty specific, 1 hour every day, aerobic, muscle, and bone strengthening. The nutrition guidelines are a little bit more numerous and not as concrete. You can see what they are. Here's 9 of them: 3 meals a day, healthy snacks, plenty of fiber, a decrease in salt. There was an emphasis just on that a day or 2 ago. I think the FDA is coming out trying to reduce salt because salt is associated with increased blood pressure, and that's is associated with heart disease, #1 cause of death in the United States. Drinking plenty of water is important, and instead of drinking, sodas or fruit juices, be careful. Those can have high sugar. Watch out for sports drinks. So watch the sugar intake in your drinks. Balance your meals. In other words, don't eat the same thing, but you want to have a combination of things. A little bit more about that in a minute. If you're going to cook, try to bake or broil instead of fry, because frying adds extra fat. Make sure your adolescent, in this case, watches or decreases, if necessary, their sugar intake, which is an issue with many young people. Fruits and vegetables for a snack. 42% of high school adolescents in the United States have less than 1 fruit and vegetable a day. They're supposed to have 5 or more. So you can see really important to increase the fruit and vegetable consumption among young people. Decrease the use of butter and heavy gravies. Now, and it's not like you can't have those, just that you don't want to make a regular staple of those 5-7 days a week. Eat more chicken, fish, limited red meat. So these are typical requirements or suggestions or recommendations for healthy eating, whether they're youth or adults. One of the tools for making healthy food choices is the myplate.gov. You could look at it there. There's the image. What you want to have are, again, it goes back to variety. You want to have a variety of foods on your plate. Notice the 4 key things on your plate. It should be vegetables. That sort of takes up the biggest part of your plate, followed by grains, and then fruit and protein. So these are all things you should have on your plate. Dairy is off to the side. That's a little bit less often. And notice you don't have other things on there. You don't have alcohol, you don't have oils and so forth. So that's what your plate and a plate for any healthy person should be try to replicate as often as possible. A little bit more content on the My Plate suggestions. This is just a reminder to eat healthy foods throughout your lifetime. Everything you eat and drink matters. I think that's an important thing to keep in mind before you put something into your mouth. The right mix can help you be healthier now as well as in the future. So here are 4 points. Focus on variety, the amount and the nutrition level of your food. Choose foods and beverages that have less fat and sodium and sugar, added sugars, that is. Number 3, start with small changes to build healthier lifestyles. I always say adding is easier too. So 1 piece of fruit or vegetable extra a day is easier than trying to take something out. And you could build from there. And then number 4, support healthy eating for everyone. And that goes everybody in your family, et cetera, your school, your community, your workplace, et cetera. So that's My Plate suggestion. So that's nutrition for young people. Let's take a look at sleep. So lots of content here. Oh, by the way, where did that come from? That's a couple of sources: John Hopkins Medicine and ChooseMyPlate.gov. So that was where the nutrition content comes from. Sleep is vital. It's as vital as air you breathe, the water you drink, the food you eat. We don't often think about sleep as important, but it's absolutely critical. The biological sleep patterns do change for young people as they get into older adolescence, and they can't seem to get to sleep until 11 o'clock. That's common. Teens need 8 to 10 hours of sleep. And so that differs from one youth to another. They need to find out what that is. Irregular sleep patterns are common. And so what you want to try to do with youth is to try to get them on a regular sleep schedule. And if not, so for example, number 4, it's very common for youth in the weekend to sleep in really late. And then come Monday, they're all goofed up because they're all rested. And so so to try to keep, especially Monday through Friday, school days, they're a sleep schedule, go to bed by 10, 10:30, 11, get up same time, and try to keep that even on the weekends or as close as you can. And sleep disorders are not all that uncommon among young people. There's something recently about in the news and research showing that there's increases in sleep apnea among teens. So sleep is very critical, and it has an impact on other health behaviors, including substance use. So let's take a look at some solutions. Make sleep a priority. You could have a sleep diary, or writing about sleep can help. Naps can help as long as they're not too long and too close to bedtime. Making sure your room is dark and quiet, and then come morning time that you can open up the blinds and let some light in to help you make that transition. Using pills and drinks and caffeine and vaping and all these other things to help control you, and high caffeinated drinks to help you deal with sleep deprivation is not a healthy way and can interfere with sleep. And when you're sleep deprived, it can be as dangerous as driving drunk. So that shows you the effects of a lack of sleep. It affects our cognitions, our ability to think, to perform, to interact, our emotions, our level of anxiety, our junk eating patterns, our lack of interest in exercise. It's all integrated. And sleep is certainly one of those behaviors that has an impact on many other areas of well-being. More sleep solutions, and all of these come from the National Sleep Foundation for Teens and Sleep, and you can see them, really good content here. Again, as I already mentioned, try to establish a regular bedtime and wake up time throughout the week. Try not to, I have a problem with this, not drink, eat, and exercise within a few hours of your bedtime, because that can interfere with you getting to sleep and even the quality of your sleep. Try to train your body by setting times to go to bed and to get up, to try to, and you could ease into that, taking a bath or shower, reading a book really works well for me for getting me sleepy. So these are all good tips. Number 4, again, writing a diary, to-do list, jotting down notes can help you get sleepy and help you deal with stress and worry, which can keep you from getting to sleep. So sort of problem solving in that. Number 5, if you hear your friends talking about, oh, I pulled an all-nighter, rest assured that they're not feeling well or doing well on that day, and you are doing much better than them because you have sleep. Most teens experience changes in their sleep schedule, as I mentioned, and especially for older adolescents, it's harder for them to go to sleep earlier. 11 o'clock is typical, and yet they have to get up early in the morning for school. So it's a structural problem as well that young people are dealing with. Shifting to stress now, here's a couple different things to consider. Here's tackling the problem. And problems can cause stress in our life. So you want to identify the problem. You want to address it. If it's not going to hurt you, chances are you can handle it with just some clear thinking, problem solving, talking with others, and writing about it and planning to address it. Sometimes, number 2, it's good to just avoid the stress. That could be people or places or situations that really cause you stress or can lead to increased stress. And to the extent you can, try to let things go. Try to not take things personally. Try to realize that it's just it's just one moment in your life, and you've got a whole life to live. And so attitude plays a role in dealing with stress, and all of this under the heading of tackling the problem, and trying to tackle the problem logically, and identify what it is that's causing you stress. Under the heading of taking care of your body, we've already addressed this, and this shows you the interactivity of these different behaviors. We know that exercise, we know that eating well, we know that getting sleep and practicing relaxation, all critical to controlling stress. So if you're already doing these things, we already talked about physical activity. If you're getting that helps you manage stress. If you're eating healthy, helps you manage stress. If you're sleeping, helps you deal with emotion, stress, and irritability. And of course, you can add to that by building in relaxation techniques, whether it be yoga or deep breathing or walking in nature, taking a nice warm or cool bath or shower, etc. Dealing with emotions, another issue. 2 points to make. Taking an immediate or instant vacation can help deal with emotions. That's where you literally leave that setting and go to a more relaxing place. It could be internally through meditation and prayer. It could be externally, moving you into a quiet space where you can listen to nice soft music or walk in nature. And then sometimes you just need to release your emotions. Under number 2, release that emotional tension. And there's 5 or 6 ways here. Creative outlets, very important. Art and writing and hobbies of any kind, really helpful. Talking with people you trust, writing it out, a log, a diary, very helpful to deal with emotions. Prayer, meditation, laughing or crying, all these things are really important to deal with emotions. So all of this helps controlling stress. Controlling stress, making the world better. I think the last point is contribute. Think of yourself as needing to and having a place to make your world better, whether your world be your family, your school, your workplace, your community, or all those things together, that you have a role to play, that you have some purpose and that by helping others, it helps you as well. So that's very important. You can make a difference, and you could do better than even maybe adults that you've seen around you that have made errors in their life. We all make errors. We all make mistakes. You can choose not to make those particular mistakes and make the world better. So volunteering, spending time, helping others, all of that pays off tremendously for helping you with controlling stress. Let's go to goal setting. Goal setting, oh, by the way, this was all from CDC, Coping with Stress, really good page, and healthychildren.org for teens, creating your personal stress management plan, really a couple good sources. Goal setting, really important. The rationale for goal setting is goal setting skills are essential to help youth identify, adopt, and maintain healthy behaviors. And this is an actual standard, a health education standard, to be able to set goals. And so here's some critical steps needed to achieve both short and longer term goals. If you look in the right block, these skills make it possible for individuals to have aspirations and plans for the future. And that's what's often lacking with positive young people, having them look into the future. What's coming up? What's potential? How do you want to shape your life? And you do have some control over that, and you can assert that through goal setting. So these are just some goals. These are performance indicators for in the left-hand block, pre-K to second grade, third to fifth grade, sixth to eighth grade, ninth to 12th grade. These are all from Centers for Disease Control Healthy Schools Standard 6, which is all about goals. So let's take a look at, for example, grades 9 to 12. These are 4 different performance indicators or standards. Assess personal health practices and overall health status. You can do that through screening surveys, for example, like those in PPW programs. Develop a plan to attain personal health goal, addresses strengths, needs, risks. Goal setting and contracting through PPW does that. Implement strategies and monitor progress. Monitoring progress is what you do. You post your goals and track it. And you formulate an effective long-term personal health plan, which I think is essential. But first, the short-term goals. Short-term goals lead to long-term goals. So there's some really important content there for youth and goal setting. Lastly, alcohol, tobacco, drugs. Alcohol and drug consumption is associated with short and long-term health problems and risks. Crashes, death, heart disease, sexual risk behaviors, cancers. And for youth age 21 and younger, they shouldn't drink and they shouldn't use substances, whether that's marijuana, whether that's e-cigarettes, whether that's opioids. Less is better, none is even better. And others who shouldn't drink and use alcohol don't just include young people, but women who are or may be pregnant, those who have medical conditions where these medications can interact with alcohol or drugs. Recovering alcoholics or addicts shouldn't be using substances. People who are doing things that require skill, coordination, alertness. So certainly, your local Uber driver, your community Amazon driver, anybody who's operating equipment, shouldn't really be using substances because of the danger involved. And this is all from Centers for Disease Control and Prevention. So just to conclude, number 1, healthy behaviors and wellness are essential to success and sustained substance misuse treatment, recovery, and prevention. So healthy behaviors and wellness are and should be always built into substance use prevention, treatment, and recovery. Number 2, there is no consensus on the definition or dimensions of wellness, but we saw the models. We went through some of the models, the more popular models, common models. They all highlight multiple interactive components. They don't always explain how they interact, but they do mention that they do influence each other, these different components or dimensions. And that leads to greater well-being, not just the avoidance of substance use or risk behaviors or injury or death. So a broader perspective these wellness models focus on. And I think that's what's lacking oftentimes in the prevention field, a broader emphasis. Thirdly, evidence-informed recommendations and guidelines exist, as we just went through, for health promoting and risk behaviors to help you and to help you as a service provider working with youth to help you set goals to improve their overall wellness, well-being, and to avoid substance use. So that's it. Thank you so much for joining. If you want to learn more, go to our website, preventionpluswellness.com. There's how you can contact us. Again, preventionpluswellness.com is our website. 904-472-5022 is our phone number. info@preventionpluswellness.com is where you can reach us. And as I said, if you register for this session, which is now going to be made, interestingly, for this week on demand, you just register for it and you'll have the link to view it. And by the end of the week, that's the, let me just double check, 22nd of October. If you've registered, I'll send you a CEU certificate, 1 hour, as well as the slides to this presentation. Okay, thank you so much for joining us. Once again, thank you for all you do for youth and for families in your communities, organizations, regions, states, nations. Thank you for letting me participate with you. And if you need anything from us, if you are exploring and interested in wellness models, do check out preventionpluswellness.com. Thank you, everyone. Have a wonderful day. Take care of yourselves. Stay safe. God bless. Bye-bye.